Indiana hospitals are now at the center of a promising treatment for COVID-19. Remdesivir is already showing some really good results. And tonight, their own Alan Carter found out that local health leaders are looking at a way to make the most of our supply here in the state of Indiana.
Right now, it's the best option we have in treating COVID-19.
What it is proven is that a drug can block this virus.
Early studies show remdesivir can help, and hospitals here in Indiana are part of finding out how much.
The IU Health system in Indianapolis are all contributing to participant enrollment and follow-up with 2 specific trials.
Samir Gupta is an infectious disease doctor for IU Health, where they're looking beyond to see if the drug works. But does it help if you treat patients longer?
Currently, we're treating everybody with 10 days of remdesivir. But if you could treat it with 5 days treatment course with the same efficacy and safety, then obviously that's a benefit and could double the drug supply.
Remdesivir still isn't widely available to all patients. In this study, it's only been used for 26 people who meet certain criteria. But even then, doctors say not everyone wants it.
Many people that we did approach over the last 5+ weeks actually declined participation because they didn't want to try something that wasn't proven yet, and I can't blame them.
But as we learn more about the drug, state health officials say it's becoming more widely available.
We've been notified by federal officials that Indiana will start receiving weekly allocations of remdesivir based on the information provided by hospitals about the number of COVID-19 positive patients they have in their facilities.
There are about 160 sites participating in the same study with IU. Now, they can't release any results until everything is complete, but they hope that will be by the end of this month.
Alan, thank you. Meanwhile, tonight, the CDC is now releasing new reopening guidelines for schools, daycare centers, and even camps. In fact, when considering whether to reopen, all 3 should be able to protect children and employees at a higher risk of getting sick. And they must also be able to screen everyone for symptoms and exposure. After that, the CDC recommends increasing hygiene and sanitary practices and training employees on health protocols. And the final step requires the ability and flexibility to monitor for signs of a spread and change course if needed. Now, all of these recommendations stress the real importance of following local and state guidelines first and foremost. Meanwhile, tonight, imagine temporarily closing a downtown street to create more patio seating for restaurants. Well, it's one of the ideas up for consideration right now as Marion County restaurants prepare to reopen next Friday. Now, only places with outdoor dining are allowed to reopen. And as you can imagine, that creates a challenge for downtown hotspots like Mass Ave, packed with a lot of restaurants there, but short on patio space. Restaurant owners say blocking off sidewalks or even parking spots for outdoor dining would be a huge help.
The carry-out model is great so far for staff and for keeping our kitchen in tune, but this would, give us one more step to get back to full service.
Now, restaurants would need a number of permits to close traffic lanes, the sidewalks, or even parking spaces for outdoor seating. But it is definitely something the city is looking into. We'll keep you updated.
Well, it's been about 2 months now since Indiana reported its first case of COVID-19, and now here we are 69 days later. We're up to more than 26,000 cases and 1,500 deaths. In that time, we've also seen this unprecedented and widespread impact the coronavirus has had beyond our state. Now, if it seems like it's one long blur, you're not alone. So how did we get here? Tonight, our Chris Vanderveen traces this virus back to where it all started.
Without context, numbers appear chaotic, as erratic as a gust of wind. Without context,
high alert for pneumonia outbreak in the city of Wuhan.
Numbers like 48 and 60 mean little, but give it a moment, because soon enough they will.
Coronavirus.
10 days after the Centers for Disease Control warned U.S. doctors of an outbreak of pneumonia in Wuhan, China, the CDC tested its first patient.
Global concern about
this new coronavirus strain
is to detect this virus early.
It found its first case 3 days later.
A man in Washington State
in his 30s
with a test found it in Washington state.
First confirmed U.S. case of the contagious coronavirus.
Following day, the president,
we have it totally under control,
appeared unfazed.
It's going to be just fine.
And day after day after day, all was fine until one day, someone suggested maybe it wasn't.
We don't know the accuracy of this test.
Not that it stopped an anxious CDC from sending those tests to various state labs, but there was clearly a problem. Supplied with the new kits, states managed to test no more than 1, 0, 3, or 2 samples per day. Finally, by mid-February, the CDC admitted
they were getting indeterminate answers.
Admitted the tests it had sent states had not worked well.
So we're taking a little extra time here.
Flawed results stalled testing nationwide. 69 samples tested, 63 samples tested. By the time the CDC remedied the problem with the tests, the president suggested the low case counts were a good sign.
So far, we have lost nobody to coronavirus in the United States.
The next day, nobody turned into 1.
Tragic news. Now the first U.S. death.
It was a male in his 50s.
This is still rapidly unfolding.
Then 1 turned into 6, which turned into 14.
Anybody that wants a test can get a test.
Context. In a country of more than 327 million, that day, the 48th day of testing, little more than 2,900 had received a test. Little more than 2,900, less than 1/100th of 1% of the country. Context. In 48 days, the U.S. had managed to test, on average, roughly 5 dozen people per day. As patients sought limited testing, cases doubled every 2 days. 400, 1,300.
Now have the capacity to test up to 75,000 people for COVID-19.
That day, the U.S. had tested roughly 6% of that number, roughly 5,000 in all tested. Deaths remained rare, 43, 51. Yet that day,
that is a failing.
And failing, yes.
It is a failing. Let's admit it.
Dr. Anthony Fauci finally said what anybody who wanted a test already knew.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
The following day, 1,300 positive cases and at least 55 deaths.
We therefore expect up to 500,000 additional tests will be available early next week.
It would take another 13 days for the country to test 500,000. 13 days of more cases and a rapid increase in deaths. 100, 200, 400, 700, 1,200. By the time the country tested 500,000, the country had confirmed more than 86,000 positive cases.
We're just learning about this for the first time.
A statewide order for people to stay at home.
And by the time the country tested 1 million, more than 3,800 were dead.
The death toll is rising.
We are in the surge, yes.
Context. During the first 48 days of testing, the country managed to test roughly 5 dozen patients a day. More than a month later, we are still trying to understand the ramifications of that, at a time when even now, anyone who wants a test still can't get a test.
Here in Indiana, we've seen a steady increase in testing since the start of this pandemic, and we're beginning to see consistently higher numbers as of last week. That's when the state opened 20 new sites testing any Hoosier with symptoms or close contact with someone infected. Now, this chart seems to indicate a little bit of a dip over the last couple of days, but it takes a few days for the state health department to collect and report all of the COVID-19 tests, so we can expect to see those numbers actually climb in the coming days. Now, the goal of the expanded sites is to test about 6,600 Hoosiers per day, so that would be somewhere here, and as you can see with this chart, we're still a little bit under that right now. Haven't hit that goal yet, but 27 more testing sites just opened up yesterday across the state. That should help us get there.